Hello. I'd like to take an opportunity to talk to you a little bit about the different types of administration of chemotherapy and how to compare and contrast and think about them in your mind when you're weighing a decision about what to do if you're confronted with the situation where you're recommended to have chemotherapy. Chemotherapy is reserved for killing rapidly dividing cells. And so when people have an untreated tumor mass and it's of a significant size, chemotherapy is recommended. Now, there are different ways to administer it and different other therapies that you can combine with it to create a synergistic effect. In the integrative oncology community, the solution is to give a low-dose chemotherapy, which is maybe 20%, 10% amount of the chemotherapy that would normally be prescribed, and to potentiate the effect of it by lowering the patient's insulin with administration of, lowering the patient's blood sugar with the administration of insulin during the procedure. And there are different techniques to do this, and we've seen the original strategy was to assess the patient's blood sugar, inject some insulin, have the blood sugar level drop rather abruptly, then take syringes filled with the chemotherapy, push those in, 1, 2, 3, and then allow the patient's blood sugar level to come back up. The theory being that there would be a kind of magic moment or period of time when the blood sugar level was low, and it would encourage the cancer cells to, quote unquote, open the gates, bring things in, and then have a better chance of the chemotherapy being absorbed and retained in the cell long enough to do its work. This method has its merits, but it's also very hard on patients. Technically speaking, a drop in the blood sugar level is essentially duplicating what happens in a panic attack. So this is very uncomfortable. It causes people to feel really bad, and it may take them hours or even a couple of days to recover. At the same time, the short period of time that the patient is exposed to the chemotherapy by the injection method, in my estimation, is suboptimal. When our heart pumps, there is what they call a cardiac output or ejection, and it basically effectively causes circulation 5.6 liters of fluid and blood per minute. So when you use the slower technique of putting the insulin in the bag with the chemotherapy, the patient's blood sugar level will drop in a very slow manner, kind of like a feather floating down in the air. And when the blood sugar level rests around 35 to 40, the infusion is maintained in that way until all the medication has been infused in the patient. So this process takes longer. It requires monitoring throughout the process. However, it will allow more absorption and exposure to the low dose of the chemotherapy. And of course, the insulin will potentiate it, as described before, and also other agents can be utilized to get those drugs to go in the cell. Cancer cells are notorious for resistance factors for drugs that are mechanisms that we have elucidated to show that basically a cancer cell can pump chemotherapy out of it almost the second it comes in. So it's kind of like a bad taste in your mouth, you just spit it right out. So we always want to do whatever we can to trick the cells into retaining that as long as possible. When you have an infusion that lasts 45, 50 minutes, all of that time is employed to increase the circulation of the chemotherapy in the body and saturate tissues. And when we're talking about saturation, areas of the body that are hard to get to, such as lymph nodes, bone, even lung, these areas are much better perfused and exposed to the chemotherapy. And as a result, this technique can make it very, very efficacious and at the same time much easier for a patient to tolerate. Now, is low dose enough? This is always the question. And we see, because conventional oncologists have now responded to the request of patients to have lower doses of drug and less than the standard milligram per kilogram amount. And what they do is just take the amount that the patient would normally get in once every 3 weeks and divide it into 3 portions and give a smaller dose every week. And this is what they call metronomic chemotherapy administration. This is not a bad idea. However, neither one of these 2 techniques, either just plain low dose or metronomic, is really going to help the patient in an optimal manner. What we need to do is not only do small bits of killing at a time, but we want to optimize the immune system function. And that requires other therapies that might be done in the days before and after chemotherapy, or even simultaneously at the time of chemotherapy. And immune system boosting treatments are what we need to do to really make the whole administration of the chemotherapy not only effective in the moment, but to be working longer term. The big problem here is that people who have cancer have deficiencies in their immune system. If you have a deficient immune system, it means your cleanup crew, the immune system, isn't going to work so well. So it's very hard on the immune system to do large amounts of killing once every so often, and might be, and often is, easier for the immune system to handle small amounts of killing, but on a regular basis. And in the recent years, even the administration of immunotherapy drugs, which used to be standard only once every 3 weeks, there are now protocols in traditional oncology to administer those drugs once a week in a lower dose. So gradually, oncologists and patients are coming to realize that perhaps a lower dose administered properly can be just as or more effective. And this has been my experience. So when I administer chemotherapy, it's really only with the immune boosting treatments to accompany it. I never give it just chemo alone. And we find that this is a very, very effective way to administer it. Thank you.